Are we talking about high T or low T? And did you know that men struggle with not one, but two different types of low T? Well, if you're a man over about 45, you may have experienced, let's say, weight gain. Maybe you're tired all the time. How about muscle weakness? Erections maybe aren't as hard as you'd like. In men, those symptoms are often tied to the loss of your hormones as you age. Well, the first hormone that comes to mind might be testosterone. That type of low T is one of the causes of those symptoms. But a different low T, low thyroid, is another reason men start to feel weak, tired, unmotivated, and maybe a little concerned about their sex life. Maybe that fat around your waist is getting a bit out of control. Maybe it's a struggle to get off the couch, even to just mow the lawn or putter around the garage. Maybe you find yourself unmotivated and just feeling blah. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Most of those resources are about hormone optimization for women and for men. In this video, we'll go over low T symptoms for men, especially men over about, let's say, 45 or so. By that, I mean symptoms of low testosterone and symptoms of low thyroid. Well, there are really four very common complaints of men who are over 45. The first would be fatigue. Are you tired all the time? Just feel exhausted? No energy whatsoever? Exercise maybe gets the leftovers of your day, if it gets anything at all. You feel a lack of motivation that shows up at work. Even when you do work, it just takes it out of you and you just want to chill. You just don't feel like you have the drive that you used to have. How about weight gain, especially around your waist? Maybe you're getting a little bit of a beer gut, eating a lot more and exercising a lot less. How about muscle weakness? We might even call it low T weakness, also known as sarcopenia or muscle wasting. You could be exhausted instead of feeling energized after a workout. Your workouts don't seem to go smoothly. You can't lift what you used to. Maybe your muscle definition isn't really there, and maybe your muscles are actually shrinking from what they used to be. How about erectile dysfunction? No morning wood anymore? Your wife may or may not be complaining about it, but you're feeling a little self-conscious, maybe worried about how it's going to affect your sex life in the long term and your marriage. Hormone levels in men over time start to disappear, kind of gradually on a slow downhill slide. Unlike women who see kind of a drop over 4 to 6 years and then wham, everything's gone basically overnight. Testosterone gradually declines starting in your late 30s, early 40s, sometimes even earlier. Thyroid, both the T3 and T4 versions, also gradually go down. And all four of those symptoms are symptoms of low testosterone, but they're also symptoms of low thyroid. Optimizing testosterone for men can help with all four of those symptoms of low testosterone in men. First of all, testosterone helps you overcome muscle weakness and gives you strength and stamina so you can work out. Testosterone can make morning wood and nighttime erections a lot stronger. Testosterone for men helps you feel greater energy just for everyday stuff, at work, around the house, at the gym. Optimizing your thyroid can also help with those same symptoms of low thyroid in men. Optimizing thyroid for men can help you with thyroid weight gain. Just right thyroid helps you feel more energy and not want to kind of sleep all day long. Low thyroid muscle weakness is as real as low testosterone muscle weakness. When you take care of both types of low T, you can feel even better. Well, you may have heard about testosterone for erectile dysfunction, but low thyroid is one of the most underrated and under-recognized erectile dysfunction causes. You just don't think about thyroid having such an impact on erections. And here's a major bonus. If you take care of both types of low T, that goes a long way toward helping men reduce insulin resistance. That's a major risk factor for 9 out of 10 of the leading causes of death in the US. I have a whole nother blog post and video about that I'd love for you to watch. Well, the bottom line is if you've been struggling with one or more of these low T symptoms, maybe you didn't even realize they might be hormone related, well, there is hope that you can start feeling like yourself again. Your best plan of action is to get your butt to a hormone optimization specialist. I know I did at around age 55 or so, and it made the world of difference. A specialist will draw your blood and find out exactly what your testosterone level and your thyroid level actually are. The best providers know the difference between hormone levels that are technically normal, but they're not good enough to help you feel and function at your best. Once your provider finds out if you have low T, they'll want to start you on one or more therapies designed to raise your T level to an optimal range. They'll probably also have some recommendations for things like diet and nutrition. They'll want you to cut out foods that cause inflammation, things like sugar and unhealthy fats and processed foods. They'll want you to maybe start taking some key supplements like vitamin D, fish oil, and coenzyme Q10, among many others. They'll want to talk about exercise, getting your heart pumping and your muscles working on a regular, consistent basis to keep your body active. They'll talk about lifestyle changes. Do you drink? Do you smoke? If so, how much? How about sleep? Something that's hugely underrated. You need to be getting 7 to 8 hours every single night. I'll bet you probably aren't, huh? Melatonin's another hormone that can totally help with sleep. The combination of all that stuff will help you get back on the path to long-term health and wellness. That means protecting your body from the very real risks that low T, both kinds, brings. Things like insulin resistance, which is basically the same thing as type 2 diabetes, which often leads to heart disease. What about prostate cancer? How about the dreaded Alzheimer's disease? If you're a man over 45 and it sounds like you need to check into low T, click the link on this video that says find a low T specialist. I know hundreds of them all over the US, a few in Canada, and some in other countries. I can't promise I know someone in your town since I can't really control where you live, but I can give it my best shot. If you are a hormone optimization specialist, somebody who can help men with all those low T symptoms I talked about, I'd love to get you on my hormone provider database. That makes it a whole lot easier for me to share your contact information and send patient referrals your way. I gotta tell you, I get tons of referral requests from all over. I think I've had something like 24 in the past week. I've got maybe 8 built up that I have to deal with soon. I'd love to see if there's somebody in your area that needs your help. Well, if you like this video, be sure to click the like and subscribe buttons to get notified anytime I post a new one. Thanks so much for watching, and we'll look forward to talking to you again soon.